he mihi nui kia koe, Louise, koutou ko ngā kaitep kōrero o tēnei wahanga, tēnā koutou. Rauranga tira mā ko tai mai marunga I te purangi, tēnā koutou, tēnā koutou, tēnā koutou katoa. So I'm going to talk a little bit about the potential of the new health system and the Māori Health Authority to strengthen pathways and speculate a little bit about what we need for that to be able to occur. This is my own view. It's not a Māori Health Authority view, but I think it is true to say we're all very keen on information, data and research. And you know, I think people will all be aware that the persistent inequities as one of the drivers of the health reforms, and equity and te tiriti focus is well embedded for the new health system. The Māori Health Authority has a broad role, can kind of be summarised as having a strategic partnership role in the design and delivery of system policy, strategy, prioritisation, planning and performance. And the authority is has roles with the Ministry of Health, Health New Zealand, iwi Māori partnership boards and the Public Health Agency. And just very briefly, I'm going to outline some of those roles. So with the ministry, we're going to partner in the development and approval of national strategy and policy for Māori, for setting and monitoring system-wide outcomes, and for providing relevant advice to ministers, although of course we also will be providing our own advice to ministers. We are going to partner with Health NZ on national and regional plans, priorities and operational strategies, including but not limited to the New Zealand Health Plan and to Health New Zealand's Māori Health Plan. We'll have a joint role with Health New Zealand with regard to hospital and specialist services, workforce and technology, and co-commissioning of primary care in the National Public Health Service, and we will be co-commissioning services for Māori that are delivered within the kind of Health in New Zealand context. We will commission ourselves, kaupapa Māori and mātauranga Māori services and solutions, and have a role in Māori provider and workforce development. And there's an expectation that the authority will foster innovation and will strengthen Māori models of care. We will also have a role with the iwi Māori provider boards and their work at locality and regional level, and with the Public Health Agency located in the ministry. So in my view, the reforms provide us with a much greater opportunity to intervene across the sector to eliminate inequities than the current system affords us, and also to grow and develop the Hauora Māori sector. To do this, we need to understand where and how inequities arise. And while we speak a lot about this and we've got some information, there are still quite a lot of gaps in that knowledge, and particularly around how do we go about eliminating them. Oops, one moment, please. There we are. So what do we know? And you know, this won't, I'm not going to labour the slide, and it's not going to be news to anyone, I don't think, but we've got inequities in the incidence, especially for preventable conditions. And we also see inequities in hospitalisations and mortality, and hospitalisations due to ambulatory sensitive conditions, and conditions associated with amenable or avoidable mortality are also associated with significant inequities. And I specifically mention these things because they are, you know, the health system has a clear role in the outcomes for ambulatory sensitive conditions and for amenable mortalities. So we have a real opportunity to have greater focus and greater effectiveness at eliminating these inequities. We've also got some clear evidence of treatment and quality of care differences, but often these are single factor or a single point on the pathway. But you know, we know through other work, so we do also have some evidence along a complete pathway. So Hill and her colleagues did that very nicely for colon cancer quite some time ago now. But they demonstrated that actually the inequities in colon cancer mortality were not the result of a big inequity at a single point on that pathway. They were the result of a little bit of inequity at many points on the pathway. And so I would argue that we need more information around kind of where inequities occur on pathways to help us. We also know that there's a relatively limited number of trials or other types of evaluation, firstly, that are appropriately designed to provide Māori specific information. So, so I'm thinking of kind of general research here. And there's a relatively limited number of trials that look at interventions that are specifically designed to eliminate inequities or of kaupapa Māori or mātauranga Māori programs. Implementation science is a relatively new field, and equity within implementation science is even newer. So when you look at the literature, it's really only in the last few years that equity has been discussed in relation to implementation science. And implementation science is studying how interventions or programs or services are implemented and can be implemented so that we can understand what the issues and challenges are, what works well, what hasn't worked well, and what people's experience of that new intervention or that new service are, but not only the whānau, or the person that is receiving that service, but also the workers within it, the funders, so everyone that's involved in that implementation. There are also have been major challenges with rolling out or scaling up or implementing what we know are successful interventions. And I can think of a number of interventions that I've been involved with that we haven't actually been able to get implemented. So when then do we think where the opportunities for strengthened pathways are? So I think for the Māori Health Authority itself, you know, that we have the opportunity to support the support the development of evidence for expanding and for developing new service models, programs, services, in collaboration with Health NZ and I think the Ministry. There's an opportunity for evidence around Māori services and programs within Health NZ's services. There's an opportunity, and we really need a pathway that allows us to understand how to embed equity across the sector, understand what works and what doesn't work, and what the facilitators and barriers to implementing for equity are. We also have the opportunity to have, in my view, a very systematic approach to what can be done to address institutionalised racism and improve cultural safety in that part of the sector. And then with the iwi Māori provider boards and communities, the hapori, communities, whānau, We can share information about local priorities. We can work to make sure that the information that communities and the IMPBs have to support their work is the types of information that they need, and is up to date and is focused on what they see are their priorities. And we can also have a clear pathway to be able to provide them with evidence about information programs and services so that they can incorporate that in their planning processes in localities and at regional level. So what do we need to realise these opportunities? Well, we need an ongoing focus on inequities and equity and te tiriti. And this needs to be, in my view, throughout the system forever, because whatever your ideology, inequities are, whether or not you think that it's a rights issue, which is where I come from, a social justice issue, or you think that it's a cost issue. So you then, inequities, we need to address inequities. Inequities are costly to the health system and to the social system. So whatever your ideology, reducing inequities needs to be part of our system. We need good relationships and collaboration, and I think the Health NZ and Māori Health Authority boards are off to a great start. We're very close in our working relationship. It's early days, and I'm sure there will be potholes along the way. But we're very excited that we're working closely together, and hopefully that kind of relationships can be modelled throughout the system. We need to make much better use of our available information. I think Don talked about how much information is available, but we just, don't make good use of it, and we don't disseminate it well. And that's all our routinely collected data, including in primary care. And we really need, I think, to have much greater access to primary care data. I wouldn't be a researcher if I didn't say we need increased funding and resources for interventions and health services research that target important and equitable health conditions, and for testing new models of care and new programs. Importantly, and I think this is a huge area, and I know from Rod's talk, he's thinking about it, and also from my co-speakers on this panel, people are thinking about it. But we really need to develop an implementation pathway environment and context where everyone from the policymakers, the funders, the service planners, and the service deliverers, as well as the whānau that receive services, are all involved in implementation. That's kind of English, so we need, that's the implementation science approach. And we also will be needing levers to facilitate that implementation. So we all need to get in the waka and start paddling. Kia ora.